to this crisis. And we're also working on distilling guidance from various sources. So we have a team of people that are doing webinar summaries for this webinar, for the weekly CDPH calls, for the weekly DFSS calls, for CDC, the National Healthcare for the Homeless Council. We know that it is really hard for you all to be everywhere, and so we're trying to cover as many of those as we can, and then we'll distill that guidance. If, a lot of times there's nothing on those calls, we won't share it, but if there is new information, we'll be sure to publish that in Slack, which is, we'll show you what that looks like in a second here. Great, and we'll be trying to monitor the go. I will promise you that we will not know the answers to every question that comes in, but we do know answers to some of the questions. And to the extent possible, I would love if people could put in the chat box any solutions or resources or things that you know about as well. We'll do our best to copy the chat, distill it, and produce a summary of that as well to the extent that it's helpful. But we know that you are on the front lines and a lot of times are ahead of any guidance that CDPH or CDC puts out in terms of innovative solutions to this time that we're in. So we appreciate and want to help amplify and provide opportunities for cross-provider communication. Okay, great. So Denise, I think we can go on. So our agenda for today is Denise is actually going to show, take just a few minutes to demo our Slack channel. We'll show you how to join the Slack channel, how to post things, what types of information you can find in there. It's really a way to avoid communicating via email and promote you all being able to share with each other. Then we'll do some overall updates on COVID-19, including coordinated entry. So Stephanie Seidman from CSH is joining us. Karen will talk about some PSH guidance. I can share just a couple of things that were produced over the weekend. We will have time for question and answers. And I think the coalition to do a little bit of advocacy discussion with us all, and then we'll share our wrap-up and next steps. So go ahead and keep those questions coming already, and we will try to answer them as we go throughout today. All right, Denise, I think you're up next.
Hi, everyone. Thank you for joining the webinar. I am going to run you through this demo on how to join our Slack channel. So steps to join is enter a invitation request from the All Chicago website, which is allchicago.org/coronavirus. At the top, you'll be able to click to a form where you can submit your email for an invitation to Slack. Once you receive that email, you'll click Join Now. And from there, you'll enter in your full name, password to create your account. And from there, you're a part of the Slack channel. So let me give you guys just a little demonstration of what that looks like. So again, we'll come to the news site for the coronavirus on All Chicago. And at the top of that, you will select to join the Slack channel. You'll just select here. From there, you'll enter in an email address that you would like to associate with that Slack account. And then once that is done, our team on the back end will send out that invitation to you, which should look something like this right here. So you just have that invited invitation, and then click Join Now, which from there you can put in your full name and a password and create account. From there, you will be a part of our Slack channel, and you guys can check out all the goodies and resources that we posted for you. If you ever want to go in there and make some adjustments to like your name, just go to the top here, hit Profile and Accounts, which this will show up for you, and then you can go to Edit Profile. For those who might already have a Slack channel, if you also go to that top here and you want to just kind of like have both of them in there, just go to that top left-hand side and then sign into another workspace, and then from there you can have both the Chicago COC channel and your original one as well. So just some little tidbit, just know that for these workspaces, an invitation needs to be given for you to join. That's just the nature of how Slack is set up. Know that if you are a member on another one, it should just either automatically add both workspaces, or you can then go and put those both of those workspaces on there. And this is just showing you again, just to get that email request from Google Forms, and there you go. And I'll hand that right back over to Nicole.
Thanks, Denise. Somebody was asking a question that we might be able to just demo, and that is if they're a member of multiple pages or channels in Slack, how do they switch back and forth? I think you just addressed it, but could we demo where people do that? Great, so it's right on the side there. You should see multiple channels there, and when you download it on your phone, it's the same way. Great.
Hey, Nicole, could we clarify
the
different folders or the different channels and what they're used for on our Slack?
Yeah, let's see. Denise, can you share that? So a lot of the channels over on the side here we're trying to set them up based on the evolving times, but we try to put a little description of what each channel is for. I would say most of the stuff is going into the COVID-19 response. The help with Slack is if you have questions. Parking lot is where we're parking questions that we don't have the answer to yet. Provider questions can go there as well. So we'll see if we can make sure that we're keeping the descriptions up to date for people. But I would say if you have questions, put them in the provider questions area. Resources go in resources. And then if there's something more general, you can put it in the COVID-19 response. Great. All right, so if you have other questions about Slack, you can go ahead to our coronavirus website, and there'll be instructions for how to reach out to us and let us know. And we'll get back to the second part of our presentation today, which are some overall updates on COVID-19. You can move to the next slide, Denise. All right, Karen.
So good afternoon, everyone. I hope everyone's doing well and staying healthy. I'm happy to talk to everyone today about some guidance. Unfortunately, not a lot of guidance for housing providers. This is mostly guidance for permanent supportive housing and rapid rehousing, though I would say it also applies for those of you who do transitional housing. So part of the updates today is really about what you can and can't do with your budget if you are a COC program funded provider, so a HUD continuum of care program funded provider. So HUD did release some guidance called Using Continuum of Care Program Funds for Infectious Disease Preparedness and Response. We'll put that link in the chat for you so you can click on it if you haven't seen it already. But basically this chart gives guidance of what you can and can pay for during the COVID-19 health crisis from your COC grants. So this is really the core aspects of being prepared and responding to this crisis with your COC resources. So the two budget line items I'm going to focus on today is supportive services, which is appropriate for any type of HUD COC grant, so whether it's permanent supportive housing, rapid rate housing, or transitional housing. And you can use your supportive service budget line item for helping households acquire the supplies they need during the crisis, right? So those supplies that keep them healthy and safe. So food, water, medication. Many of our households may have trouble accessing medication at this time. If they need transportation because they need to go to an appointment or disseminate information. The other thing you can use your supportive service budget line item for is if you need to bring on additional staff for a temporary or permanent basis to deliver these services on disease preparedness. So if you need more staff to go out in the community and deliver things to people, you could hire staff to do that. The second line item that you can use a bill for is operations. So again, the spirit of this is ensuring that households have what they need to be healthy and safe. So you can provide furnishings, maintenance, and equipment to support operating housing during this time. And again, you can hire on a temporary or permanent basis more staff in order to have this to support the infectious disease preparedness. So our advice to all of these grantees is make sure you review your budget and note whether you are underspending or not. If you are underspending, we would encourage you to try to utilize some of these funds for these activities. If you feel you need to make an amendment to your grant, then of course you need to reach out to your HUD community planning and development representative to see if a grant amendment is possible for your underspending. And if you don't know who your rep is, feel free to email COC programs and we can share that with you. So the other thing I wanted to talk about is I think this guidance from HUD just from the budget really speaks to the fact that HUD wants you to continue to help households and to house new households. So this is a health crisis, and we know as housing providers that the best way to improve someone's health is through housing. I would also say that in reviewing the governor's order to stay at home, it's clear in that order that human services operations is an essential service, and it is a reason for people to leave home either to provide services or to acquire services. So I know that that's scary for a lot of people because of this health crisis, but we can keep ourselves safe and do increased calls to clients to make sure that they are getting what they need. We can meet with people in person. I talked to one housing provider last week, and they implemented an IDHS screener that they talk to someone and make sure that they are, in fact, that they do meet certain requirements before they go out and meet with someone. So these things are possible, and it is an opportunity to be creative and utilize technology and to the best of our ability. I think we've also talked to some providers who are really looking at this as a period of high anxiety and even some, traumatic experience for many of the households we're serving. And so we need to keep that in mind and try to alleviate this anxiety and trauma if we can. We would also say that more than ever, we need to keep housing homeless households. So we've heard some rumors that people aren't taking in new households, but there's no way that homeless households can quarantine or have social distancing if they don't have a home. So shelters are very full in our city, and we still need to keep moving people out of unsheltered and sheltered environments into housing. And we hope to have more guidance within the next week about how we can continue to rapidly move people into housing. I know many of you are concerned about documentation, right? We're concerned that HUD may come over someday and look at our documentation and say, why didn't you meet this deadline? Or why did it take longer than this number of days to get this? especially in light of the fact that offices like Social Security and the Illinois Department of State are closed. So how can we get identification? How can we get Social Security cards? How can we get verification of income? So without a waiver from HUD, and who knows if there will be one, there may be. In the meantime, All Chicago is going to release some guidance this week that we've developed with support from the local HUD office to give some detailed information about documentation. So we want you to keep moving people into housing. And we know, and the local HUD office knows, you can't get the documentation. So this is where, and some of you have heard me on other calls, that documenting is so important. Like, you need to document your attempts. So the fact that you have a new household and they don't have an ID, you need to document that this occurred during COVID-19 and document that the Department of State is closed for new IDs, and that you keep attempting to do this week after week until you can get it. And all of that documentation that notes you've made about all of your attempts, like, eventually you're going to attach that to the documentation when you get it, so that if HUD ever comes out and says, why was this late, you have all the background documentation. So we're going to put some really detailed steps like that together, so you understand what you can keep moving people into housing without some of the regular documentation we need. Other things that we know are happening in the community is the CHA offices are basically closed to in-person interviews, and so they're trying to do some things online over the phone. But I think the real message from All Chicago is that really this is a health crisis, and it's requiring us to implement housing first in its purest form. And that is, we're eliminating barriers to housing, because quite honestly, the barriers are so high now that we have to say we need to house people without identification or without verification of income, but knowing that we will get it in the future. And I mean, we've talked to a lot of providers over the last week, and it seems clear to me, and I hope some of you are interested, that I would love to do a problem solving and sharing session with housing providers. I've talked to providers, and they just have some great ideas of how they're making sure they can still house and serve people without going out to see them or without the person-to-person interaction. So if you're interested in that, please let us know, and we want to schedule something soon. So there was a question in the chat. I'm just going to address it because I have it up, about the lack of documentation for new households that apply to CHA. So we've reached out to CHA, All Chicago has. We haven't heard back from them about whether they're laxing some of their documentation, but we're going to continue to follow up with them until we have an answer, because we do know that's a big challenge. And I'm going to pause there and then transfer it to our good friend Stephanie Seidman, because one of the next questions is about adding people to the CES. So Stephanie?
Stephanie, I'm going to find you. I think you might be on mute, but let me... Stephanie, we still can't hear you. Maybe try disconnecting and calling back in. Sometimes if your computer connected first, it might not have connected you. And while we're doing that, Karen, just to give her a few minutes to do that, do you think you could talk about...
You want me to start with Stephanie's stuff before?
No, go talk about CHA.
Oh, okay. If
we want to go forward.
CHA. Yeah. I thought you wanted me to channel Stephanie for a minute there.
You probably could.
So again, the CHA updates we have, I mean, this is kind of evolving too, is that we receive...
Hi, can you hear me now?
Hi, Stephanie. Let me finish the CHA and then we'll come back to you. So essentially the offices are closed. They're not having anyone come in person to their offices. They had released for the Housing Choice Voucher participants that they can use the participant portal to update their information. We'll put that in the chat. For the for property owners, they also have the owner portal that they're utilizing. They released that they will respond to email and phone. It sounds like CHA is trying to do some interviews over the phone to get people into housing. Again, we don't know a lot about CHA, but we'll continue to reach out to them and hopefully get some answers. And then we did post both of the announcements on CHA on Slack so people can get to them. So people can find those emails, phone numbers, the link to those portals if you need to share them with anyone. And I'm going to turn it back over to, and I don't know if it applies for project-based vouchers. So the direct guidance we've heard was for Housing Choice Vouchers, and then just general information after their offices really closed for all to the public. So Stephanie, I'm going to turn it over to you.
Can you hear me now?
We can hear you, Stephanie.
Oh, great. I'll just ask because I do. Do you also hear my echo?
No, it doesn't sound echoey to us.
Well, hello, everyone.
Could you talk a few minutes louder? For people said that they can't hear you very loudly.
Sure. I will speak as loudly as I can. I hope that's better. I will just mention that because of my echo, there are going to be some pauses in my speech. But I'm glad you don't hear the echo. So hello, this is Stephanie Seidman from CSH. And I wanted to just share a few updates about coordinated entry. To begin with, we have suspended housing assessments until April 1st for all populations except veterans. The main idea is that a standardized housing assessment doesn't create an immediate solution for non-veterans, and we don't wish to send people to congregated spaces unnecessarily. If you can go to the next slide. For anyone serving veterans, the VA Community Resource and Referral Center will not turn anyone away in person, though they are recommending phone calls if at all possible for health reasons. The CRRC is able to complete housing assessments. They're also connecting people to other resources as well, perhaps grant and per diem, transitional housing, and so on, if needed. One quick update is that supportive services for veteran families or FSVF programs can offer a hotel or motel option to highly vulnerable veterans experiencing homelessness. And FSVF providers are currently working with the VA on a plan. More information will follow soon, but some veterans will certainly come out of both sheltered and perhaps unsheltered settings into motels. Next slide. For households who have completed an assessment, we're asking if there is an update to share it by calling the Coordinated Entry Call Center. This is the phone number here on the screen, 312-686-8255. 361-1707. And you can see that that's Monday through Friday, 8:30 to 4. So no one will be required to share an update. In other words, no one will be exited from the one list because of missing an update during this time frame. Though if anyone has new contact information or something to share, they should please call this phone number to make that update between now and April 1st and beyond. Next slide. Things have not changed dramatically on the non-assessment side. We have seen a slowdown in requests for matches, but the matching team is still fully operational and addressing requests. With the slowdown in openings, there's been a slowdown in referrals to navigators, but all housing system navigation programs are operational and doing their best. As Karen mentioned earlier, some offices, the Social Security Administration offices, for example, are closed. So some ID is not possible in this time. And our greatest hope is that housing providers will house participants without ID, but navigators are able to take people to their housing intake appointment or provide transportation and just still continue to support participants. For supportive housing providers on the line, bridge housing is still an option as well. Just wanted to mention that if you are able to accept people even without all of the documents and such, people could be moving into a bridge unit while they're waiting for offices to open and so on, or for the unit to be ready. Next slide. So for us, there's some key next steps, and our leadership team will be meeting tomorrow afternoon to address a few major points. One is the consideration of our coordinated entry prioritization practice. So the leadership team will discuss the overcomplicated shelters, the need to connect people who can immediately be found to the housing openings that are available, and other matters. No decisions at all have been made, but we'll meet tomorrow to discuss this. The leadership team will also discuss our strategy so that we can share with you beyond April 1st, such as how we can operate a virtual approach to access points and limit contact as best as possible, along with our assessment strategy. We update our website regularly, and so I just wanted to mention you're always invited to look at www.csh.org/ChicagoCES. The banner is our COVID-19 response, and any key updates are posted there regularly. And the only other next step I wanted to quickly mention is that the state of Illinois did submit an 1135 waiver, and just to acknowledge that that was accomplished, one key piece of an 1135 waiver is to have Medicaid pay for emergency housing. It was submitted, and that's the extent of my knowledge. So just wanted to mention that. The next slide is just showing you contact information for how you can be in touch beyond the chat feature today. If you couldn't hear me at all, I will call you back. If you have any questions, feel free to put them in the chat or reach out later. Happy to be in touch. Thanks so much.
Thanks, Stephanie. And I think we were going to save all questions until the end, but I feel like because questions are coming in about coordinated entry, it's probably okay to just address them now, if that's okay. And so I know Avi has asked a a couple of questions about opening coordinated entry back up using the call center instead of dropping access points, and just how can we leverage, you know, technology and assessment processes over the phone. And I know that was one of your things that you're going to be talking about with the leadership group tomorrow, but if there's anything you can say now to speak to that, that would be great.
Sure. So at the same time as this health crisis, one of the two assessors at the call center had a crisis, and so we were not in a position to go virtually broadly at the moment that we were making some planning considerations. So what we determined was that we're building up a virtual platform, and in the meantime, we didn't want to say assessments are closed in one place but open in others, which might drive people to physical locations unnecessarily. And so just out of a perspective of being as cautious as possible, we've said, let's not make housing assessments our number one priority. They do not lead to an immediate response outside of the veteran population. So even if we were at a better situation with our capacity, we wouldn't have a different housing rate than the one we have without them until April 1st. So that's why we've determined that we had asked all skilled assessors to just halt until April 1st. It's the easiest thing for people experiencing homelessness, I think, to understand that they don't have to go from one location to the next to see who is accomplishing this. But just that we're taking a break until April 1st. But when we come back April 1st and before that, we'll have a lot more information about a virtual plan and capacity for it. And we do appreciate everyone's patience on this. We can't actually stop people from doing it. HMIS is open, but we're just asking. It will help to have a consistent message. Please don't make housing assessments your first priority at this time. And instead, you can help people get to do an update. We can connect veterans because that housing has not slowed down. That kind of thing.
Great. And then Joy asked if bridge units were still available for anyone to get housed, and including singles, or is it still limited to families? And then what is the process for bridge units? I'm not sure if you can answer that, Stephanie. If not, we can follow up afterwards.
So my understanding is that currently bridge housing is specifically for unsheltered singles who are facing chronic homelessness and connected to a housing provider for supportive housing, but not able to move in. I think it's a great question as to what about families? To my knowledge, that's not currently an option. It's a terrific question. And I can put in the chat box more details about connecting for supportive housing providers, how to connect folks to Bridge.
Great. And Margaret is doing that as well.
Yeah. You can always reach out to All Chicago or Nicole at the Center for Housing and Health about bridge units.
Great. And then Sherry asked just for clarity, are people who will be matched, will they be contacted for interviews prior to April 1st?
One thing that would be really helpful is if housing providers on the line would chat your responses back to that question. We have found that some providers requested matches and then sent staff home. So it has happened that intakes have been postponed or intakes have been virtual. But if people want to go ahead and just share, how does it work for your organization in the chat, that would be really lovely.
Great. Thank you, everybody, for putting your questions and thoughts in the chat. We'll make sure that Stephanie gets a transcript of this to the extent that it's helpful with tomorrow's leadership group, and we'll continue to push out any information about further changes regarding coordinated entry through Slack and email, and it'll be on CSH's coordinated entry website as well. All right, Denise, let's go to the next slide. Yeah, thanks. Two slides ahead. That'd be great. So shelter update. So just because we are promising to try to amplify all of the guidance and communication we're hearing about, I want to just touch base on some updates regarding emergency shelter. So for some of you that listened in on DFSS's webinar last week, this might be a little bit redundant, but I think it's still really important information. So over the weekend, CDPH issued guidance for homeless shelters. We'll put a link that you can access this guidance because we're not going to go through it in detail, but especially if you work closely with a shelter or have a shelter at your agency, you should be reviewing and abiding by this guidance as much as possible. It states things like all clients entering the homeless shelter must be screened for COVID-19 symptoms and risk factors. There's also a screening tool that CDPH released that would be helpful. You're supposed to separate clients with mild respiratory symptoms that are consistent with COVID-19, and it lists what those are. And then it also tells you what to do if you have a client with severe symptoms. So you're supposed to arrange to receive immediate medical care, notify the transfer team, let CDPH know. So all of this guidance is in there, and I want you to know where it is and bookmark this link so that you have it at your fingertips. And keep asking questions. So, anytime there's a piece of guidance released, it hopefully answers 50% of your questions, but might make a lot of new questions for you or not answer everything. And so if you can communicate those questions, especially by putting them in Slack, you might get a response from someone who knows, and it'll also help us roll that information back up to CDPH and DFSS so that we can get you the answers that you need. So CDC over the weekend also issued interim guidance for working with people who are unsheltered. So they talk about prevention measures for encampments, how to manage communications, practices for outreach staff, as well as isolation housing. So please refer to that if you work with or have questions or thoughts about how people who are unsheltered should be incorporated into this response. And then lastly, we want to let you know that CDPH issued guidance for hospitals and emergency departments for discharging people who are homeless and unstably housed. It's not in their normal guidance section. It just specifically went to their health network team, and it's pretty technical in nature, but Doug Nichols did a great job of sort of pulling out the key pieces that are helpful in it. So basically, emergency departments and hospitals who are discharging people are encouraged to designate someone who they're considering a COVID homeless liaison. And that homeless liaison person is supposed to coordinate with CDPH as needed for someone who is homeless or unstably housed. So this is really guidance for people who are confirmed cases or have exposure and symptoms, but who do not need to be under medical care, but they're intended to be in quarantine and isolation. So that just came out late last night, and so we do not have a lot of other answers about that, but we can, we'll see if we can get a link to that for those of you who want to read the technical piece. It's a little bit embedded and hard to find online, but we'll see what we can do to find that. Great. Next slide. Okay, so this week we are working to identify some case management best practices as it relates to how we are all needing to change the way that we work with this population. So best practices on telecase management models or doing social service work from home. If you have any thoughts or resources or ideas on this topic, please put them in Slack, and we'll do our best to kind of roll all of that information up into something that might be helpful for people as we're all transitioning to this new way of working. Next slide. All right, so at this point, we just want to open it up and see what other questions people have that we have not answered. And like I said, I can't promise an answer, but the more questions you ask and try to answer for each other, I think that'll help us all, and it'll also help us go back to our partners to say, wow, we're really hearing that this is a big problem or a big issue. So I guess It doesn't have to be just a question. If you have a statement or a concern, please put that there too, and we'll do our best to talk through them. And Doug, while we're doing that, I can't remember if there is a link that we could drop into the chat about that technical guidance for hospital providers, but if so, if you want to get it in there, that would be helpful. It seems like a lot of people are asking about that. So one of the other questions that a couple of you asked right at the beginning was there's some information that's becoming from IDHS, so it's the Illinois Department of Human Services, saying they're making $6 million available throughout the state for emergency lodging for people experiencing homelessness, and that these emergency funds will be made available through the local continuum of care. And All Chicago is the coordinating agency for Chicago's continuum of care, and so we anticipate that we will be working in conjunction with the rest of the continuum of care and our continuum of care board of directors to figure out the process for how those funds can be distributed and used. Right now, we do not have a lot of guidance about exactly what the eligibility criteria are for those funds, and so there's still a lot of questions to be answered related to that, but we are doing our best at All Chicago to dedicate as many resources as we can to making any funds that we have available, making it easy to access and getting those out the door as quickly as possible. So more information to come on that. Great, so seeing other questions here. Mindy asked, I saw guidance that you were releasing regarding the use of HMIS for reporting on COVID symptoms and diagnosis. Are there further thoughts about that? And Karen just said we're working on that. So if other people are curious, just know that we are working on that. Great, and then Doug just dropped into the chat box how you can access the CDPH Health Alert Network, where that COVID-19 guidance came from for hospitals who are discharging patients and are supposed to assign that COVID homeless liaison. So somebody asked about any advice on accessing emergency funds for tenants. So this is a great question, and I feel like we can probably drop in the chat box where on All Chicago's website you can access information about how our emergency funds are currently distributed. So we typically identify, and it's the same way for the state homeless prevention funds, we typically identify a group of partner agencies that have a fund manager, and then calls go through 311 to the homeless prevention call center and get routed back to our partner agencies to access those funds. I will say that we are hoping that there are new funds coming to the system, and we don't know if those are going to come through us or whatnot, but we will do everything that we can to streamline and make clear what the process is for all of the funds as it relates to the homeless system. So we'll keep updating our website as much as we know that information and sharing it through Slack and through email anytime we see that there are new funds opening up, and try to be clear about what the process is. Oh, the Chicago Furniture Bank is closed right now. If anyone has any other ideas about how to help people access furniture in this time, please put that in the chat. What other questions do you have, or comments or thoughts? What things are going well for you? What are you seeing are some of the biggest needs for the people that you serve? Great, and then we are monitoring the chat. Any questions that we're not able to answer, we will try our best to find the answer, but that's why it's critical that people join Slack. And honestly, I had to download it to my phone to make it functional for me, because I have my phone with me at all times, and when I see something on Facebook, I just put it right into Slack, and so it might be helpful for you all to download it on your phone as well so that you have it at your fingertips. We are trying to push as much communications about this topic through there, but of course anything related to funding announcements, we'll try to also put that on our website and send an email about it as well. But if we're not able to answer a question today, we'll try our best to get an answer out as much as possible. Great, and we'll keep posting the Slack link to join in the chat a couple more times while we're on today. We'll also make sure that we do a summary of this webinar and put the slides in Slack so that you can access those. All of the resources we've mentioned today are in there as well. Great. We're just giving us a second here to comb through all of the questions. These are great. You know, this is one, somebody asked, should we be directing folks seeking emergency shelter to go to hospitals and ERs? My guess is that no, we don't want to be doing that. We can, as a team, look back at the CDPH guidance and see if there's any guidance about that, or follow up with DFSS. If anybody else knows the answer to that question, if you're getting walk-ins and sort of trying to figure out where people should go who need a place to stay tonight, if there's an answer, if you could throw it in the chat, that would be helpful. If not, we'll follow up with DFSS. Great, and then I do want to make sure we have time for Mary to talk about some updates from the Chicago Coalition for the Homeless, so keep the questions coming in. But Mary, if you want to unmute yourself and just kind of talk through some of the things that are going on at the Coalition, we would love to have you share that information with everyone.
Thank you so much. Yeah, this is Mary Tarullo with the Chicago Coalition for the Homeless. We really appreciate having some time to talk with you all today. And just really want to thank you all so much for the work that you're doing during these, unprecedentedly challenging times. So we have identified what we believe are the most immediate needs for people experiencing homelessness to keep everybody safe right now. We've spoken with some of you about these, and we've also, of course, talked to the people in our base who are experiencing homelessness right now. So I'm going to walk through them in a minute, but just wanted to say, what our plans for these are. So we're working to get feedback from the city on these, on this proposal so that we can come to agreement about what the need is. And then we want to identify with the city how much money is needed to meet these needs. So then we can advocate together for the resources from various government entities together. So what we have identified are the immediate needs are, one, isolation housing. So we're recommending that everybody experiencing homelessness on the street, as well as those who are in shelters who are either 60 years old or more, or have underlying health conditions, are offered isolation housing. So our numbers for that we have taken from the PIT count. And in Chicago, combining the folks everybody on the street, as well as those in the shelters with underlying conditions or 60 plus, leads to a need of about 2,800 beds for isolation housing. For also a need for isolation housing will be food, transportation, welcome kits with hygiene supplies, as well as with withdrawal with withdrawal medication. Moving on to additional shelter capacity for de-intensification. So we've gotten recommendations from city staff, medical professionals, and shelter providers like you all who have recommended that shelter occupancy be decreased by at least 50% in order to alleviate the dangers of overcrowded spaces. So of course, each shelter is different, and we will need to identify needs on a case-by-case basis, but we've come up with an average percentage in order to just estimate how much money we need to be advocating from the state. And so if we're going to increase the number of beds by 50%, that will require about 1,800 new beds across the city. The next immediate need is additional staffing. So the shelter de-intensification will require additional resources for staffing, including overtime, replacing volunteers who have fled with staff who will have to be paid, hazard pay, protective medical gear for staff, and also allowing shelters that are not 24 hours to be turned into 24-hour shelters, because we do not want to be sending people out on the streets, at 8 a.m. or whenever your program closes. That just does not make any sense. So the staffing needs on a citywide basis would be 2,800 for the new units of isolation housing. And then we're also calling for a quadrupling of the homelessness prevention fund, up to $40 million, just anticipating that there will be many households who will be newly at risk of becoming homeless, and we would much rather spend our money keeping them in their housing versus entering into the shelter system. It will save the state a lot of money in the long run if we can do that. So that's why we want to really invest those resources in homelessness prevention. So that was a lot, and I'm happy to send this to Nicole to send out to the entire group so that you can review it and provide any feedback. But I did want to open it up if there were, I don't know how much time I have, Nicole, so if we don't have time for this, that's totally fine. But I will say, if you would like to be more involved in pushing these needs at the city level, please email me at mary@chicagohomeless.org. That's MARY @chicagohomeless.org. Or if you have any, feedback about this, I'm seeing some things in the chat, but it's a lot to talk and read at the same time. Yeah. So Nicole, please just let me know if we have time to talk about this at all now, or if I should respond to folks a different way.
Yeah, I mean, you are the last part of our presentation. There are a lot of questions coming through, and not many that I think we know the answers to from all Chicago staff. So if you, I'm just combing through them now, if you see any that are helpful that you could answer, I think we could do that now. I know a couple people have asked, is there a link or a written summary of the coalition's recommendations? I don't know if that's something that people could access, or if they should just reach out to you.
Would it be okay if I had you send that out? I'll email it to you.
Yeah, we'll do that. We'll actually put it in Slack, because that's what we're putting for all of the summary from today's webinar, and the webinar summary and the recording link. They'll all go in Slack, so we'll make sure it's all connected. Okay, great. So what is the contact for someone needing isolation housing? That is not in my wheelhouse. I mean, my understanding is that when there's somebody who presents symptoms, that you're supposed to call IDPH. But Nicole, please correct me. This is not, the operations side is not what I'm focused on right now. Oh yeah, that's okay. And if don't answer any questions that you don't know. I know that's how we feel too. Is like, I really want to answer every question, but there's more often not an answer. So I don't think we know that answer quite yet. Okay. And then changes in the laws for homelessness prevention. So the resources side for homelessness prevention, we are going to be advocating, we are advocating on a state level for a quadrupling in that fund. If you have thoughts on
changes in the laws around homelessness prevention and what needs to be changed. Maybe you have in mind like eligibility criteria or something like that. We would love your feedback. So please email me if you have specific thoughts about what laws would need to be, what would need to change about the homelessness prevention law.
Great.
How can someone unsheltered access funding for a hotel room? That is going to be a process that we're going to need to work out with DFSS about how people on the street would get placed in that housing. Currently, people from the street are not getting placed. This is just what we're proposing to the city, to be clear. We have not gotten agreement from the city to do these things.
That's a great clarification. So I think that's a great place to stop, Mary, just because we are at time and I know people have other things to get on to their day with, but we will, we can share a transcript of the questions too for in case it's helpful for CCH, and we're trying to be mindful and not have people join, too many different webinars, and so to the extent that we can combine Coalition, All Chicago, and DFSS webinars going forward, we're trying to talk about what that would be like and make that happen as much as possible so that you all can just get all the information you need in one place instead of a lot of different places. So that's our hope. If you have other ideas, we'll keep the chat box open for another 5 minutes or so. So as you're leaving, feel free to, even if it's just say thanks and bye, we'd love to just hear from you. And thank you all so much, and have a good rest of your day.